The market for specialty drugs is growing really fast. Maybe only 1% of the drugs prescribed would fall into this category, but it's a quarter of spending. It'll be half of spending within the next few years. I have a new study on specialty drugs. Now what these are the latest, greatest high-tech biotech drugs. These treat really serious life-threatening conditions, cancer, multiple sclerosis, HIV. The problem is these drugs are very costly and they're in many cases very fragile. They need to be handled very carefully and stored very carefully. These are the types of advanced therapies that need to come from a specialty pharmacy. Specialty pharmacies are trained, they're highly qualified to administer these drugs, to distribute these drugs, and to store these drugs. The therapy costs anywhere from thousands per month to tens of thousands per month. 2 decades ago, back around 1990, there were only a handful of these drugs. Now there are several hundred. In fact, that is increasing very fast. The odds are that you and your family will at some point use these drugs in the future. Maybe 1% of the drugs currently prescribed would fall into this category of specialty drugs. These drugs account for a quarter of all drug spending. And over the next few years, many experts believe the market will probably rise to about half of all drug spending will fall into the category of these very costly specialty drugs. Because of the amount of money involved, a lot of unqualified pharmacies and drug distributors are trying to force your health plan and your drug plan to admit these unqualified providers to their networks to sell you drugs for the money, but they're not qualified for that. Health and drug plans only want to work with the most qualified, specialized pharmacies who have agreed to price concessions but also can handle and distribute and store these drugs so they're not damaged. The bottom line is that these drugs are very costly, they're advanced, and as more and more of our drugs are these highly advanced specialty drugs, there's a lot of stakeholders who want in on the action. What my study has found is that Congress and state legislatures need to avoid enacting well-intentioned but ill-conceived regulations that are meant to protect consumers and patients, but really have the opposite result.